Hi everybody, welcome to my poster presentation on cerebral palsy. Cerebral palsy is the most common motor disorder in children, so you'll run into children with cerebral palsy if you decide to work with children with disabilities. You'll definitely see some people with this. There's three different kinds. There's spastic, dyskinetic, and ataxic, and the commonality between them all is that they produce challenges with balance and coordinated movement. There's a lot of really positive advancements coming out though with the identification and the treatment for people with cerebral palsy, and now it's estimated that 2 out of 3 will walk by the time they reach adulthood, 3 out of 4 will talk, and half, 50%, will have normal intelligence. A big reason why is because they're able to identify children now as early as 5 months, and parents are also getting much more informed about what to be looking for. And some of those things that you want to be looking for are if the baby's able to lift their head by 6 months of age is usually a good indicator. If they are able to put their hands up together and to their mouth to eat by 6 to 10 months is very important. And then being able to crawl by about a year. A lot of times with cerebral palsy, it'll affect one side of the brain more than the other side, and so you'll be able to see imbalance that way. So the reason why it's so important to identify cerebral palsy early is because it's a neuromuscular disorder with origins in the brain. The muscles themselves are actually fully functional and work. It's just that the connection between the brain and the muscles is damaged. And so if you're able to identify this early, you can capitalize on interventions that support neuroplasticity, which is actually regrowing of damaged neurons to be able to help these muscles fire that weren't firing before because the brain wasn't able to tell them to fire. So besides those kind of observational things that you want to look for, there's also more rigorous evaluations. The most steadfast, I guess, one would be just an MRI. You'll be able to see if the brain is damaged, but then there's the Hammersmith and the developmental assessment of young children that look at the movement, and they can say conclusively yes or no if the child has cerebral palsy. So there's a lot of resources out there because it's such a common condition. What that means is there are a lot of resources. There's one called No Barriers USA. This is national. Lots and lots of support for children with cerebral palsy and their families. The other one that I found that's in Colorado is called Parent to Parent Colorado, and gets parents together. So parents really need as much support as you can give them. There are some findings that I found in articles when I was doing research, and I guess the themes of them were the early identification was huge because the earlier you can identify, the higher the possibility of neuroplasticity increasing function for their whole life. The other things were parent training and parent support were extremely important and identified in all the literature. And then the last was the environment being either supportive or and sometimes hindering the performance of children with cerebral palsy. There's also this great first-person account called Christy Brown's My Left Foot, an insider's insight into growing up with CP. It's always great to hear about disabilities from the perspective of the people with the disabilities themselves. The best way to learn. So interventions. One intervention that I found was called GAME, stands for Goal, Activity, Motivation, Enrichment. Basically what this means is you get usually a toy or something that's very motivating for the child, and you try to use that toy to elicit some kind of movement, and the therapist will what they call scaffold that movement. So they'll help do it as much or as little as they can. They'll help the baby to move towards that toy. And then as soon as the baby starts to initiate or push into the movement at all, then the therapist kind of pulls back the support, the scaffolding. And so what you want to do is you want to slowly pull back your support as much as possible and establish a motor pattern that they use to grab a toy or something like that. And then once that motor pattern is established, then what's great is that you can generalize that motor pattern to do all kinds of other tasks like reaching for food instead of a toy. The other big intervention approach that I really like is called just an environmental modification. And so I'm studying occupational therapy, and what we really focus on is how the environment either can be enabling or disabling to performance. So sometimes people with a disability, their disability is a lot of times could be more in the environment than it is actually in themselves. So an example of that would be for a child with cerebral palsy. If they're in a normal high chair seat, they're not going to be able to sit up straight. And they might be sliding down the plastic slippery stool and things like that. But there's adaptive seating that you can give children that sits them up in a nice straight up posture, and they're able to participate in mealtime despite cerebral palsy. And so when you're able to offer something like that to a family where it's like, we just have this thing that is going to change your life and make it so much easier, that's a huge benefit that we can offer. Something that's really important to say, though, when you're recommending these kinds of things is that some of them cost a lot of money. So you really want to talk to the families about what's within their budget and what's possible for them before you make a recommendation for like a $20,000 wheelchair. Last thing about interventions is that really doing as much to support the mental health of the parents and educating the parents about how they can do these interventions themselves is very, very important. Something that I love about that game intervention is that it's so simple that once you do it a few times, you can teach the parents. And all of the things that I've talked about as far as interventions are home-based interventions, which is most appropriate for infants with cerebral palsy because you want to work with them when they're 5 months old in their homes as soon as possible. All right, thanks for listening. I hope you all enjoy your time at the poster presentations.